questions. We have our MD MBA students in the aisles here, so please let us know if you have questions for the panelists.
It seems that you are kind of looking at a short forecast. None of you, especially John, made any statement about education as a key for cost containment forecasting for the future. Can you comment on that?
Probably by design, because most of the employer world in which we deal with isn't necessarily focused on underlying education. I think you pick up pieces of that as you see the transitioning workforce. So with younger people coming into the workforce, depending on what their educational backgrounds are, you start to see a different shift in thought process. And the other piece that you pick it up in is this need to help people navigate through the system. And so much of the navigation tools are going to be online support tools and those kinds of resources, which inherently come with a communication/education component. But it's usually on the employer side of things. It's not so much the underlying background of the individual in their education as opposed to what do we need to teach them to help them navigate their care situation and the system that we've created.
Thank you. I was hoping for something more insightful, but thank you.
Are you saying I'm not insightful?
I'm saying you're too late if you're looking at the employer impacting health. I think that especially looking at the grim forecast that you made and your realistic, ondulant kind of historic, if you invest in high school and elementary school, you may have actually solved major health problems, and all the stuff on nibbling at the end right now would be 20 years from now less significant.
I think you're raising a good point, and one of my clients actually is involved in what we're calling more of a community leadership position, where they're working with other employers to try to identify what are the underlying drivers of poor health in a community, and they're trying to coalesce with the providers to create solutions for the entire population, not just their own. So you may see efforts like that, but that's almost like a unique circumstance. This client happens to be in Hawaii, so their model is completely different. Their culture is completely different. And what most employers are struggling with is how intrusive do I need to be? Because again, that's my world. How intrusive do I need to be versus how much freedom do I allow for people to make their own decisions? My personal bias is that over time, it would not surprise me if what we see is employers backing away from this idea of trying to modify individual behavior, because everything that we've seen to this point suggests it's not going to happen. And if that's true, then ultimately it does fall on the individual. And then I think what you're saying takes on more importance, because as you look at your own personal circumstance, what are you going to do to change it? I historically have suffered from back pain, and I went to a physician, and his poster, spoke volumes for me. He had a poster in his office, showed an individual on a golf course at like 85 years of age, looked very healthy, picking up his ball out of the cup. Showed another picture of an individual at 85 in a wheelchair. And the commentary was, which one would you rather be? And so I do think there is an underlying need, but the problem is that most of health isn't overtly obvious. If every time you took a bite of a cheeseburger, your heart contracted, you'd stop eating cheeseburgers. But it doesn't happen. And so we live our lives somewhat in a vacuum.
Thank you.
Could I respond just slightly?
You're going to disagree with me?
No, I'm not going to. I don't know if this is on or not. 3/4 of education funding at the state and local level is at the state level. This is why controlling the cost of Medicaid is so important, given that the states have that major. To Jim's approach to increasing productivity, which I agree with you, and increasing health in the future, you're going to have to invest in education at that level, and even preschool. But if you are having to fund Medicaid at the levels we're going, then you're going to constrain, or else you're going to have to increase the tax at the state level or the federal. So I think there is a relationship here between the states, the federal, and education and productivity.
Hi, Cindy Enos, and I'm the person who always has a question. But that's because my husband won't let me ask questions at home, so sorry. But Jim, particularly, I want to understand what you see as the effect of pensioners retiring now without adequate savings and essentially relying on their Social Security payment, and then also the impact of students coming out with significant amounts of debt, including my daughter graduating from medical school with a lot of it, and the depressing effects that that would have on domestic consumption, since it's such a big driver of economic performance in the country.
You know, I think student loan debt, it probably encourages families to take on some of that, get your kids out of the house. I think really what you, but when you look at the system as a whole, the household sector, student loan debt is large, $1.3 trillion or $1.4 trillion, but relative to the overall picture of the household debt situation, the debt trends have actually been coming down. And more important than that, to us economists, is debt service. Debt service, the amount you pay off every month relative to your income, is as low as I remember since the Fed started doing this survey in the early 80s. So we who have kids in college or have those debts are focused on this. But the truth is, it's not really, in the aggregate, it's not really something that I spend a lot of time thinking about. And I think part of the reason is, interest rates could change that, but it's because interest rates have been coming down as inflation came down over the last several decades. And that's why we are where we are, and we all realized we could get a bigger mortgage and have the same monthly payment. But I think, when you think about the household, the pensioner issue, really, there's always going to be populations that are struggling. But when I think of America, this is what I see of America. The balance sheet today, American household sector, and this isn't everybody, the balance sheet of America is at levels we have never seen before. If you had a choice to time travel, you would never want to travel back to where our grandparents were or where our parents were. So for the economy as a whole, from my point of view, people have more resources today than our previous generations did. It doesn't mean that everybody benefits from that, but I think the truth is, when you look at these surveys of who owns wealth, if you survey my extended family, what you would find out is that 10% of us own the wealth, but all my family has an opinion about how to manage the wealth. They know the wealth doesn't go to heaven. And that's why I think these surveys don't really capture what's really going on with wealth. So I look at America, I think we're really lucky. This idea, we got to make America great. If you live in Bangladesh, I think you would think, geez, America's already great. What's the big deal? So I think broadly, that's not a big issue. I think there's always people who are struggling. That's always going to be the case, but we got fewer people today struggling than we've had in the past, and you see that, and you see that in the way Americans behave. Our saving has declined to very low levels. Why? Because our savings are going up, and that's the difference.
And actually, this one does have an employer application. When we talked earlier, there are two pieces that I think tie to this. One is this notion of well-being. And so employees are basically saying part of this whole well-being thing is my financial well-being. And it's not just what I'm making on the job, it's what I'm able to put away for my retirement and how my employer is supporting that. The other piece of it, and it just disappeared. But I think where I'm going with this is the whole notion of broader benefit concepts. So in addition to just traditional benefits, medical, dental, vision, et cetera, we're also starting to look at college debt retirement. And so if an employer has a population that generally is in that situation of I've got a big college debt burden, I'm concerned about saving for my retirement, how do they redistribute the investment that they're making in order to help those folks reach their objectives? So I think you're going to see a lot of that.
It doesn't go to heaven, but I wonder if it goes the other way, because because the point I'm beating a dead horse here. The debt that we're accumulating nationwide, that's a tax on those future generations and their standard of living. So that's my concern.
Good morning, Cheryl Skolnick, now from Optum, part of United Health Group. So question for the panel, but particularly from our friend from Ian Hewitt. Normally, in this panel, we've gotten some sense of where employers or where health insurance premium trends are. We've heard a lot about pricing, which is a really important discussion, but what are your folks telling you that they're seeing happening to their insurance or total cost of care trends over time? And do you see any ability to inflect that given their willingness to change at this juncture?
I think employers have been somewhat lulled the past few years because overall trends have not been as aggressive as they had been in prior years. But that is changing, and some of it is changing because of the pricing issue that I described. So our actuaries have come up with their latest forecasts, and we're looking at somewhere between a 5 to 6% overall trend. And whether or not employers can mitigate that trend kind of depends on what they have done in the past and what they're willing to do with respect to all of the strategies that we raised earlier.
Thank you. Just one follow-up. So, Bill, the reason I am thrilled to have you back is because of the honesty of your perspective, and thank you for that. It can't be easy for someone who's served his party as long and honorably as you have to now have to stand up there and admit that the deficit is what it is and the debt burden is what it is under a Republican administration and Congress. So thank you for that honesty and that perspective. It kind of restores my faith in the process a little bit. But I guess my sort of follow-up question here, again on the employer side, I'm intrigued by that chart that you put up. Yes, I'm aware that millennials are taking over the earth, but do they actually understand that employers aren't their parents?
No.
Right. Right. So in that case, I think your point about how the employer approach to benefits is changing is really interesting, because what you've essentially defined is a move to defined contribution as opposed to defined benefits. And are you really hearing anyone talk about that? Because we haven't heard that in a long time. So I've heard it, but we haven't heard that in this conference for a long time. So thank you.
Yeah, and I'm not sure if I overtly tied it to defined contribution. I think you could see defined contribution strategies, but more so if you expanded the exchange concept and you lost the tax-preferred status for your subsidy, you might move in that direction. There's an indirect defined contribution when we start talking about broader total rewards and flexible benefit concepts, because you are providing a, quote, bucket. But most people conceptualize defined contribution as I'm fixing my spend, and I may not hit the microphone. I may not change my spend over the course of time. Really, all defined contribution from my perspective means is I'm showing you that bucket, but I'm adjusting that bucket over time to match what I can afford as an employer and what you need as an individual. So it's a little bit of a different mindset.
Hey, you know what's interesting about this issue the bill raises, and we all sort of are worried about this fiscal picture. It's not the first time we've heard this. It's been going on. CBO has told us about this. You know what's really fascinating? If you went to sleep a couple decades ago and you woke up today and you saw this picture, I would not knowing anything, I would say, gee, interest rates must be 5 or 6%, long-term interest rates. And the mystery is why is the bond market not reflecting this? Interest rates are much lower than I would expect them to be. And we're not even back to normal yet. Yeah, but even we are the best we're the best house in a bad neighborhood, but that is still an issue.
That's a big deal.
And we grew up thinking the bond market is a bunch of vigilantes that worry about these things, and they're not. So, maybe it's coming, but I think I think what's going on is because we get CBO guys coming up to New York all the time to talk about this issue, and they say, we don't understand why the bond market is where it is. And our reaction is, well, because we think the bond market knows that is not a doable outcome, that we'll be forced to take action one way or the other, either get the economy moving faster or manage healthcare better or get Social Security retirement ages lined up better. I think it's not an unrealistic assumption, but it is weird.
There's been a proliferation of wellness plans at the employer level. Those wellness plans, with the passage of time, have had requirements added to them, and in some cases extending beyond just the employee to also the employee's spouse. Is there any evidence that these wellness plans are in any way bending the cost curve at the employer level?
If I take off my Aon hat for a second, no. So
Can I take off my previous Cigna hat and say no also?
yeah, and again, this is personal perspective, but and I'll share a real life story. I had a friend who lived a very decadent lifestyle, drank, smoked, overate, never exercised, had a heart attack. Survived. 1 year post-event, I ran into him. He was lean, stopped drinking, stopped smoking, epitome of health. 2 years post-event, overweight, drinking, smoking. And that was my revelation. It's like if a near-death event is not enough to elicit permanent change, then $50 a month is not going to do it. And so I think the biggest mistake that consultants as well as the employer community have made is they've tied wellness, the idea of physical well-being, to reduction in bottom line medical expense. It's never going to happen. There are too many variables that influence whether or not you're going to see a return. And I think that's why employers are now starting to think differently about what wellness means and wrapping up the definition to reflect a broader concept of well-being.
There was a recent study out at University of Chicago, I believe it was, that looked at this specific issue. And while they did not find any benefit directly in terms of cost reductions, they did find one benefit of this program was the fact that the people who were receiving his benefits were impressed that their employer would take that concern for them, and that was the benefit of the program more than it was the actual.
I have some question regarding productivity, and it's really good. That's the goal and outcome in the next years to come, and that will really be very effective in healthcare, especially going to the cost benefit. I just remember I attended this seminar with a CBO representative and mentioned many years ago, more than 5 years ago now, that the focus, it will help in regards to disease care management. And it's like an example of congestive heart failure. They spend a lot of billions of dollars managing those cases, and they keep going back to the hospital because of that. The thing that I really see is that there's so many barriers of entry, and it's too bad a lot of the experienced people are all retiring in the baby boomers sector. And I find that since I work in the hospital, it doesn't really move a lot with regards to that, because it really has an impact. We spend so much on the budget regarding that, but I just don't see it, how this productivity will entail, because there's so many barriers of entry, like example also of hiring the right people. Okay, we didn't really expand on productivity, but I could see but something has to be done in reality, in real time. Because on the new grad section also, people are getting more task-oriented and we don't expand. We have to work, if you work in the healthcare providers, we really had to work like a team because we go back, the focus also is on the wellness because if luckily I have that kind of experience. I know how to manage to prevent them rehospitalized. It's not just congestive heart failure. The diabetes has a very increased, preventing them to go into end-stage renal failure. So it kind of connect to everything that process. I'm just I just want to see the productivity is really the right answer, but how can we all help each other out to get that going? Thank you.
I'll throw out something, and many of you might take offense because I think we've got a lot of folks in the healthcare industry in the room. When we start talking about productivity and engagement, what do we really mean by that? And so, to me, if an organization is trying to get its arms around productivity, it first has to define it. And it's going to be different if you're talking about C-suite versus folks at the other end of the spectrum. So what are the measures? What are we thinking productivity means? Once you get there, you then have to decide, well, how do we assess this? Do we have the data that will help us understand what we've just defined as productivity we can actually measure in some fashion? A lot of times the productivity discussion breaks down there. Let's pretend that we actually can capture data. Then it's, what are all the variables that influence productivity? And we all, and I'm guilty of it as well, have been operating under the assumption that an individual's health has a direct and significant impact on productivity. What if it doesn't? And so one of the things that we're starting to do is what we're calling workforce optimization, which is starting to align all of the data that we can get and isolating the variables that will have a direct effect on productivity. And it includes your compensation, it includes company policies, it includes ergonomics, it includes workforce environment, management style, all of those things, including individual health. And what we're hoping to find is which of those factors have the greatest impact, and that's where the employer will make the investment. So it's possible that individual health is critical, and you'll see a renewed level of, I'm looking at health and physical well-being as an investment. I've got to stop doing that, in order to gain productivity. But it's also possible that we may look at all those variables, and that's fifth on the list. And we need to fix all the other stuff first.
One question. 2 slides I think I saw referenced mental health. For many of the healthcare providers in the room, it is a black hole. It is a bottomless pit. And the government is not set up to handle this problem. And I'm wondering, you talk about employee well-being, you've got depression, people can't even access their own programs. So I'm wondering how we're going to grapple with this as a cost factor going forward, because it is so intertwined with physical well-being, but yet we as a country haven't even set up a system, or we've bifurcated the system to deal with the mental health side. So if you guys could kind of comment on how we're going to deal with that piece going forward.
They're going, no, we're not touching that. I mean, I can comment from the employer side, but go ahead.
From the government's perspective, I think you're absolutely 100% on the mark. And not to blow smoke at my organization called the Bipartisan Policy Center, but we're working with an organization out here called Wellbeing Trust. We're integrating clinical health with behavioral health is critical. And how the way to mesh those two together, I think, is going to become a critical issue. As it relates to the opioid crisis and all the issues that go along with that, I think that is exactly where we're going to be focusing, and maybe not this year. I mean, they put $6 billion into opioids. I don't think that's probably much, but how do you integrate clinical health and behavioral health will be the issues. How do we integrate the payment systems? How do we reimburse appropriately? What do we reimburse? I think you're absolutely on the mark, and I do think there's a growing recognition that the two have to be integrated going forward.
And from an employer perspective, again, I'll touch on some of the comments that I made. If you have that broader concept of what constitutes well-being, well, one of the elements is emotional. And so there is a behavioral health component. You raised a very good point with the opioid crisis. I think that's actually crystallizing for employers that there's a problem out there. And so I think you will see a greater emphasis on behavioral health, comorbid situations, and how to effectively manage those conditions on behalf of the workforce. In terms of a broader commentary, I think that what we've done as a society is, can we speak French here? Is totally back-asswards. Because we've basically defunded a lot of our infrastructure that was designed to help people with mental health conditions, and we've left them to fend for themselves on the streets. And you know, it's wrong. And then we scratch our heads when we look at what is happening on the streets and wondering, well, geez, how do we fix that? Well, part of it is to reprioritize where we're going to invest our dollars for care.
We have time for maybe 2 or 3 more questions. I'll lead with one if nobody has one right now. Okay, so just following up again on the wellness issue, I'm not going to let this one off the hook. So there is emerging evidence, actually from the University of Illinois, showing that in a randomized controlled trial, showing no real effect of wellness programs on health or spending. And you've mentioned this kind of broad category of wellness. Are employers continuing to roll out the traditional wellness program, or have they decided we're going to put that aside?
Well, that, I think, in large part is driven by who their advisors are. Any client that I have is not investing in traditional wellness. And I do think that if you just think about, you know, how you go about defining if you got a return, well, healthcare is, you know, from one year to the next is a point in time measure, and wellness is longitudinal. And over the course of the cycle, what happens to your population? There is so much turnover in that population that it's really hard to apply a longitudinal measure to a point-in-time concept. And the other variable here is by tying it to medical expense, which is what I said earlier is the biggest mistake. What if 10% of this room tomorrow trips and falls, breaks a leg, and incurs a medical expense? Are you higher risk at all compared to what you were last year? No, but your overall expenses went up. And so the whole idea of managing risk effectively, longitudinally, and then trying to tie that to what happened to my medical expense in any given point in time, just is flawed. So I would never,
Looking at our wellness program, the real obsession is getting your BMIs in line and your A1C. The problem that I see is, and that's what we're all focused on, the thing is the benefits of that are really long-term, right? So how would you know? The wellness program that we've had has been maybe a decade or so. It's going to take 2 or 3 decades to know whether my diabetes issue is under control or...
So I want to make one comment about that, which is that what they've shown is that the people who take up those programs are the people who are going to use them anyway. But with that, I will.
But there is, I think, one important distinction to make. There's a difference between health risk assessments and trying to manage risk over time versus identifying underlying clinical issues. And someone mentioned diabetes. And addressing that specifically as a significant illness burden for the population. And so doing that, I'm all in favor of if you can build that better mousetrap, but just making a blanket investment on trying to alter the risk profile of my population most likely is not going to generate a return.
Oh boy.
I'm Jeff Margolis.
Head of wellness.
Actually, I think wellness is a bad term,
Yes.
and that's part of the problem. And you, among others, perpetuate it.
No, I don't.
But
I don't call it wellness anymore.
But let me set up a question. There's a systematic discontinuity in the thinking of this panel that was reflected. So, Bill, you said you made the kind of joke that the only thing that employees valued in the quote wellness programs was the fact that their employer cared about them, and the entire room laughed. Right.
I'm quoting a study.
I understand. But the entire room laughed, as if to say it's not useful. Cheryl asked the question, do millennials understand that employers are not their parents? And you all said they don't. And they don't, by the way. And this gentleman asked the question about education. And John, you appropriately, I think, tried to take the question of education a bit towards the notion of health literacy, right? But here's my question for you: is the entire system today is set up as a sick care system? You peddle sick care benefits programs, John, and you add on programs that are wellness and other things, which is good and useful. The large insurers for self-funded employer groups add on those things, mostly for add-on revenue. But if you push this thing all the way back, are you guys saying that increasing health literacy education, starting younger in schools, actually teaching kids that if you consume more calories than you burn in a day, you gain weight, which you would think would be obvious, but that's not taught. That the absolutism that comes through in food advertising on one side and more of a balanced approach to it's okay to eat a donut every once in a while as opposed to fast food is like the devil because there's a lot of things people have to balance off in life. And if you actually start thinking about the data, we know that only 30% of what drives health is medical care and genomics. 70% comes from what people do every day. So are you guys giving up on that? Are you giving up on influencing the 70% factors? And if you're not, how could we turn this into a more constructive dialogue about how to take sort of the one-size-fits-all wellness approaches and biometrics, and everyone in here who's an athlete knows BMI is a stupid measure if they have any muscle mass whatsoever. But how do you propose that we take the experience that you've all garnered in your career and fix that moving forward? Or do you really think we should abandon the consumer?
And I think there's a lot going on there. And let me see if I can remember most of it. So first off, I did want to comment that folks in my industry, if they're doing their jobs right, we're consultants. We don't have a product to push, so to speak. So we're not promoting sick care. My role specifically is strategy. So what I do with an employer is try to understand where they are as a business, where they need to go to be successful, and how the people component influences that. And if an employer says, I am willing to make an investment in people across the entire spectrum, whether it's physical well-being or any other dynamic that we talk about, that's a completely different animal because you're doing it for a business reason. The comment that I think I was making is if you're doing it specifically to manage medical expense and someone's holding you accountable for that, you're never going to be able to demonstrate that the investment you made generated a return. So there are a variety of reasons why you would want to invest from a well-being perspective. The other layers to your questions in terms of more of the grassroots concept, I don't know what role you'll see employers play in that, and so maybe the other panelists can comment.
Number one, I agree with you. In fact, one of my last bosses, Dr. Bill Frist, a former majority leader, uses that 70 to 30% statistic all the time. And I agree with you. I don't know what your alternative to wellness is, quality of life. But when you talk quality of life, you're not just talking, you're talking education, housing, transportation. You're talking the whole panoply of social services out there. And so population health. So I just think that I'm not giving up on it at all. I think it's important that we continue to have this discussion, but I don't think we should necessarily think it's just the employer's responsibility either. I think something called personal responsibility and family responsibility right down to the beginning of life. In fact, I think that's where we have to focus our attention.
And why are employers involved in this whole discussion at all?
I don't know.
We sort of disengaged, we've disengaged, it came out of World War II, right? We've disengaged people from the process of taking on personal responsibility. We've sort of learned, we've grown up learning someone else's responsibility, and yeah, if you want to do things, fine. We've got to take personal responsibility like everything else in life, and that's why we talk about consumer-driven health initiatives, and that's where we ought to be going.
And ultimately, though, there is a broader dynamic at play, because whether it's employer or personal, it almost doesn't matter who's driving it. If the idea is I have to eat better, I have to exercise, I have to do all these things, well, what does eating better mean? There are healthier foods, there are organics, and you're talking in many cases, that stuff that's really good for you costing more. And you don't want all the processed stuff that goes in the freezer. And so if you truly start to transform what your diet should look like, and you're in an economic class that doesn't enable that, how are we going to address that? So there's a broader societal issue here.
I want to be careful. There's also a big brother aspect to this that I want to be very careful about. We've tried in fact, we have a little project going on as it relates to the SNAP program and trying to say you can't provide sugar-sweet beverages, purchase them through your food SNAPs, the old food stamp program. I tell you, you're starting to touch upon some First Amendment rights of the individual. That's right.
Thank you very much. Please join me in a big thank you to our panelists.